Hello and welcome to this short video guide for patients undergoing total knee replacement surgery at Niagara Health. In this short video, we will review how to prepare for your surgery and what to expect during your hospital stay and discharge home. This information is also covered in your pre-op education booklet. Please note that all information presented in this video relates to physiotherapy and occupational therapy protocols. This information is not intended to replace the medical advice of your doctor or healthcare provider. You will receive additional information from other disciplines that is not covered in this video during your pre-op appointment. The knee is a hinge joint that allows your shin bone to move backward and forward on your thigh bone so that you can bend and straighten your leg. Sometimes the smooth coating over the bones gets rough, dry, and worn away, and the muscles weaken. This can make your knee painful and hard to move. You may need a knee replacement to lessen your pain, improve the function of your knee, and make your knee more stable. Your surgeon will remove your old knee joint and put in a new knee joint. This is called a knee replacement or arthroplasty. Complete the following tasks to ensure you are prepared for surgery. Start an exercise program to get stronger. Arrange your household to keep important items within reach. Create a clear path in your home. Remove all electrical cords, throw rugs, and anything else that may cause you to trip and fall. Install night lights to make it safe to move around at night. Install handrails on inside and outside stairs. Ensure you have a high, firm chair with arms to sit on. Use furniture risers or a firm cushion to raise the chair height if needed. You may want to consider installing grab bars and a handheld shower in your bathroom, but these items are not required. You will also need to obtain certain pieces of equipment, which we will describe next in this video. If you can, practice using this equipment. And finally, please arrange for assistance with shopping, transportation, cleaning, and pet care for approximately 6 weeks. You must rent or purchase the following pieces of equipment prior to your surgery. A two-wheeled walker. The following pieces of equipment are not mandatory, but are useful in many situations. A cane if you need to use stairs and for when you are ready to transition away from using your walker. A raised toilet seat. Or a commode. A tub transfer bench, if you have a bathtub. And a shower chair, if you have a walk-in shower. Dressing and bathing aids if you do not have assistance at home, including a long-handled reacher, a long-handled shoehorn, a sock aid, elastic shoelaces, and a long-handled sponge. Please note some vendors are not open on weekends. It is important to obtain all of your equipment prior to coming to hospital. Please bring the following items with you to the hospital. The Your New Knee Education Booklet. Your glasses, dentures, and hearing aids. Loose, stretchy clothing. For example, loose underwear, jogging pants, stretchy socks, and a loose top are good options. Lightweight supportive shoes. No backless or poorly fitting slippers are allowed. Your two-wheeled walker, and please ensure it is labeled with your name. Your personal items such as your toothbrush, toothpaste, and grooming items. Your CPAP machine, if you are using your device at home. And please leave your valuables at home. You will go home from the hospital once you meet the criteria for discharge. This could possibly be the day of your surgery or the day after your surgery. Make arrangements ahead of time for someone to pick you up, take you home, and stay with you for a few days. If you live alone and you require more help than your friends and family can provide, consider respite care. Respite stays are offered at some retirement homes. Each retirement home will offer different packages, but generally accommodation, meals, and housekeeping services are included in the cost. You or your family can arrange this prior to surgery. All equipment should go there with you. Alternatively, you could consider hiring private housekeeping, meal delivery, and personal support services. These services would assist you in your home at a cost. After your surgery, you will need to follow these rules to help your muscles heal, get strong, and move well. Follow these rules for at least 6 weeks after your surgery. or until your doctor tells you to stop. Rule number 1. Move your knee often. Do the exercises your therapist has taught you. Rule number 2. Do not use a pillow or support under your knee. Pillows and supports cause the muscles and ligaments to shorten, making it difficult to straighten your knee. Rule number 3. Follow the instructions you are given about weight bearing when walking. And rule number 4. Sit on firm armchairs with seat height level with knees until you have enough muscle strength and range of motion to sit in a regular chair. After your surgery, you will be seen by a physiotherapist. The physiotherapist will review a number of topics prior to your discharge from hospital, including your weight-bearing status. Please note, unless otherwise told, you will be weight-bearing as tolerated. This means that you can put your full weight, or as much as you can tolerate, on your operated leg. Your physiotherapist will also review the following topics, including the exercises that you will be expected to complete in hospital and at home. How to transfer and walk safely with your walker. This includes getting in and out of bed, chairs, and a car. How to navigate stairs. And any additional equipment recommendations and energy conservation strategies. The majority of your recovery and rehab will take place at home. The following recommendations are important to support your successful healing. On discharge, ensure you are taking your medications as directed. Follow your knee rules. Use your walker for safe mobility. Change positions frequently and avoid sitting for greater than 45 minutes at a time. This will reduce swelling and stiffness in the knee. Perform the recommended exercises. Keep your dressing bandage clean and dry unless otherwise discussed with your surgeon. No showers, baths, or use of hot tubs, swimming pools, or saunas until discussed with your surgeon. Arrange to have your follow-up appointment 2 to 3 weeks after surgery or as ordered by your surgeon. If staples were used, they will be removed at the follow-up appointment. Ensure you have a physiotherapy appointment scheduled. This will either be at an outpatient clinic or through Ontario Health at home. If you are receiving physio through Ontario Health at home, the physiotherapist will visit you at your home. Do not drive or return to work until directed by your surgeon. Thank you for taking this time to prepare for your surgery. Please refer to your education booklet titled Your New Knee for more details, and if you have any questions, please let your inpatient therapy team know. Finally, on behalf of the whole Niagara Health team, we wish you a swift and smooth recovery from your surgery, with hopes for your health and well-being in the days ahead.